So you have your patient, she's again 41 years old, she's had palbociclib and letrozole, she's had fulvestrant, and she's had Xeloda. She's got ER positive, HER2 low breast cancer, and you're thinking about starting her on TDXD. And she asks you, what about sacituzumab govitecan instead? So I think the question is, what do you tell her? There are these two options. And I think the answer is, with the TDXD, we have progression-free and overall survival benefit in patients with hormone receptor positive HER2 low disease. With sacituzumab, we have a progression-free survival benefit, but we don't have an overall survival benefit in patients with ER positive breast cancer. You could also tell her that with TDXD, she would be treated once every 3 weeks, whereas with the sacituzumab govitecan, she would need treatment on day 1 and day 8 of a 21-day cycle, so a little more frequent. You could tell her with trastuzumab drugstocan, you would be less likely to have problems with blood counts than you would with sacituzumab govitecan. And then finally, I think you could tell her that both of these drugs will be options for her. You would probably recommend, I think, the trastuzumab deruxtecan or TDXD initially, just because of that overall survival benefit and potentially a little bit more ease of administration with the treatment every 21 days. But she definitely would be a candidate for sacituzumab after she progresses on TDXD. So again, great to have options, but those might be some of the reasons you would choose TDXD first.